What's going on, guys? It's Jimmy here. Welcome to our daily show where we discuss everything you need to know about and what's going on here in our country on a daily basis. In this video, we got a lot to talk about here. Senator Joe Manchin's wife getting, well, the company she works for getting hundreds of millions of dollars yet again. We'll go over that here in this video. Also, new SNAP benefits to go over here in this video. And seniors getting a benefit here as well. We'll go over that here in this video as well. So if you're new to our channel here, make sure to subscribe down below to our YouTube channel. If you haven't yet, it's completely free to do so. Click the bell icon after you subscribe so you don't miss out on new videos that come out here every day at 10 a.m., 3 p.m., and 8 p.m. Eastern Standard Time. And thanks so much for liking and sharing these videos. Let's jump right in. Okay, yeah, Senator Joe Manchin here. Once again, politics, sometimes, you ever hear politics is corrupt? Once again. Commission led by Senator Joe Manchin's wife is set to receive millions of dollars more from the Manchin-backed omnibus. This headline here from Fox News. Commission led by Gayle Manchin will receive $200 million in 2023 from Senator Joe Manchin-backed omnibus bill. So here's the details on this. Let me know your thoughts on this. West Virginia Democrat Senator Joe Manchin III backed the $1.7 trillion omnibus spending bill in December, which included a $200 million increase in funding for a commission overseen by his wife. That money is now set to be paid out in 2023. The commission in question, the Appalachian Regional Commission, known as ARC, employs Gayle Manchin, paying her a salary of roughly $160,000 annually. The median household income in West Virginia is about $50,000, according to the U.S. Census data. In March 2021, Gayle Manchin, an educator and former West Virginia official, was initially tapped by President Biden to serve as a federal co-chair of the ARC and was unanimously confirmed by the Senate. Senator Manchin, who exercises outsized influence in the Senate as a critical swing vote, voted for the omnibus spending bill that includes increased appropriations for ARC following his wife's appointment. Inside this $1.7 trillion omnibus bill that was 4,000 pages and passed the Senate last month with a 68 to 29 vote with Republican and Democratic support, was $200 million appropriated for this commission ARC, and also represents a $5 million increase from last year. Senator Joe Manchin previously helped craft earlier legislation last year that allocated $1 billion in funding over 5 years for ARC. Wow, which roughly doubled their funding levels. Kind of makes you wonder what's going on there. And, we see so many politicians from both sides. We see, Nancy Pelosi and Mitch McConnell, who have both been, there in their positions forever. And, you see their salaries, in the Senate of like 200,000, something, around there, varies a little bit. Even that being a lot, you think about that over 5 years would be like $1 million. But, Nancy Pelosi and Mitch McConnell both worth somewhere around like $100 million or even more in some cases. Kind of makes you wonder how they're worth so much money. You guys can let me know your thoughts here in the comments. Of course, term limits have been wanted by the people for many, many years. The problem with term limits is that the politicians themselves would have to vote it in. So they would essentially have to vote themselves out, which has not happened yet. Yeah. Next up, did you know you could double your SNAP benefits in 27 states with this program, at least in a way per se? Yeah, so I wanted to let you guys know about this here because I seen this, and part of my mission on this channel is to help as many people out in as many ways as possible here, and make you guys will help you guys stretch your dollars as many in as many ways as possible here. So let me show you guys this. If you're a member of the SNAP program, Supplemental Nutrition Assistance Program, also formerly known as food stamps, there's over 40, it's either 40 or 60 million people on this. You'll know that it isn't easy to feed a family on food benefits. It's true that the total benefit amount has increased in recent years, really just because it goes up with inflation. However, the skyrocketing price of food combined with the pandemic emergency provisions mean that some families will actually receive less money in 2023. One of the ways you can stretch your SNAP dollars is a program called Double Up Food Bucks. Let me know if you know about this. Double Up Food Bucks. It only applies to fruit and vegetables and means you can get double the value for every dollar you spend in participating farmers markets and stores. Farmers market and stores. It's like a 2-for-1 offer on all of your produce and makes it more affordable to buy healthy food for your family. This can make a huge difference to your bottom line and ultimately means more money in your bank account. So here's how the Double Up Food Bucks works. In participating states, Double Up Food Buck teams up with certain stores and farmers markets to give SNAP recipients access to lower cost produce, basically by 50%. Every dollar you spend is worth two, or as New York Double Up website puts it, you can turn an apple a day into two apples a day. And yeah, pretty good. You can use the program at any old farmer's market. You'll need to check on your state's website for participating locations. You can find the project. You'll find the project is more established in some states than others. For example, in Michigan, where it was founded, there is over 250 locations, where Nebraska only has 12. There's also a limit on how much you can buy each day, usually around $20, but $20 each day is that can add up quickly. You can double your fruit and vegetable money in these states. The program has spread quickly throughout the U.S. since 2009. It doesn't operate in every state, though other states do have similar projects. Here are the Double Up Food Buck states, as well as the daily spending limit. Alabama can do up to $20 per day. Arizona, up to $20 per day. You can pause the screen here on your state if you need to. California, CalFresh, up to $10 per day. Colorado, up to $20 per day. Hawaii, get 50% discounts restricted to one transaction per SNAP card. Interesting. Idaho, match spending on your Quest card at participating markets and stores. Indiana, match SNAP up to $20 per day with the St. Joseph's Community Health Foundation. So I think it's just $20 per day. Iowa, $10 on every visit. Kansas, $25 per day. So again, this is per day, so you could really do it every single day. That's still a pretty good amount, right? Massachusetts, 50% up to $5 or $10, depending on the location. I think that's per day. Michigan, up to $20 per day. Mississippi, up to $20 per day. Missouri, $25 per day. Nebraska, $20 per day. Nevada, $20 per day. New Hampshire, $20 per day. New Jersey, Get Food Bucks programs, matches SNAP card programs. Okay. New Mexico, matches payments locations. New York, $20 per day. North Carolina, $20 per day. North Dakota, $10 per trip. I think if it doesn't mention here, like these states that Like New Mexico, if it just says, I think it's basically just a 2 for 1. I don't think there's a daily limit. I think it is what it means here. I could be wrong though. Oklahoma, $20 per day. Oregon, $20 per day. South Dakota, $20 per day. Tennessee, $20 per day. Texas, $30 per day. Some markets may have different limits. Utah, $30 per day. If your state doesn't offer double up food bucks, then it's worth checking to see if there's anything else locally. For example, Washington has something called Snap Market Match, which works in a similar way. Louisiana has a similar market match program. It doesn't really matter who operates the program. What is important is whether it helps you with fruits and vegetables, and you may have a different program that's just slightly named something different or works in a similar way. So let me and our viewers know down below in the comment section if you knew about this, if you use this, and if it works pretty well for you. I mean, hey, if it doubles basically your dollars, it sounds pretty awesome. And we love fruit here in our household. So let me know your thoughts here in the comments. Pineapple is definitely my favorite fruit, but I eat every single morning. Well, not every single morning because we vary it up, but I eat yogurt with fruit in it and granola. But some mornings I have like oatmeal with bananas and like some honey in it and stuff like that. So I definitely like to eat a healthy breakfast. Not that I eat healthy all the time, but it's good to start off a morning with a healthy breakfast. Let me know what you have. Medicare begins to rein in drug costs for older Americans. So again, it's good to see stuff like this happening here, as long as this doesn't get repealed here, which is something that they're talking about here. But this is the headlines here. New York Times. Here's the details on this. Yeah, for example, Steve Lubin, a retired intensive care nurse who paid $1,582 for insulin out of pocket last year in Philadelphia, spent a lot of money last year on insulin to control his type 2 diabetes. Um, Replies on Medicare for health coverage, including a Part D plan to cover drug expenses. Yet his out of pocket costs kept mounting, including a deductible of $480, monthly supplies of 2 forms of insulin, and higher prices once he entered the coverage gap. His total insulin tab for just 2022, $1,582. Yeah, he's 68 years old and was cheering for the sprawling Federal Inflation Reduction Act, which, among other provisions, called for capping insulin prices for Medicare Part D beneficiaries at $35 a month. So $35 a month would be, 10 months would be $350, and add another $70 onto that for the extra 2 months with no deductible. With no deductible. He signed petitions circulating by the American Diabetes Association and the Pennsylvania Health Access Network asking Congress to vote yes. So that did pass. My income is definitely down from when I was working and the expenses go up. He said it's difficult. But he supported the bill because after working in an intensive care unit for years, he had seen patients suffer the serious consequences of diabetes when they could not afford their prescriptions. And unfortunately, there's millions of people every year that cannot afford their prescriptions. You take their history and find out they were rationing their insulin or couldn't take it at all. In Congress, or in August, Congress passed the bill and President Joe Biden signed it. His out-of-pocket insulin cost for 2023 will fall to $1,630, which would make it like almost $1,000 in savings per year. The legislation establishes other requirements to lower drug costs for Medicare beneficiaries as well, about 3/4 who have Medicare Part D plans. It's one of the biggest changes to the way Medicare Part D or Medicare deals with prescription drugs. It signals lawmakers' willingness to take on a very powerful lobby. Some provisions took effect this January 1st. Others will phase in over the next several years. Collectively, these represent substantial out-of-pocket savings costs, especially for those who use expensive drugs. And as we get older, these costs will go up and there'll be more and more medications. Beneficiaries will see three significant changes in 2023. The first is the $35 cap on insulin, which will affect more than 1 million insulin users who have Medicare Part D through Medicare, Advantage, or freestanding plans. From 2007 to 2020, beneficiaries' aggregated out of pocket costs quadrupled, even though the number of users only doubled. They spent an average of $54 a month on insulin in 2020, according to the Kaiser Family Foundation. The cap will save average users at least 35% and applies immediately without requiring them to pay a deductible, which amounts to $505 in 2003. In the second major change, adult vaccines covered by Part D, typically offered at pharmacies, are now free without deductibles or copays, just as the flu and pneumonia vaccines covered by Part B have been. That will, in particular, improve access to the shingles vaccines, the most expensive adult vaccine. In 2008, the Kaiser family reported Part D enrollees paid about $57 per dose out of pocket, and each recipient needed 2 doses. So that would have been like $114. Although shingles risk rises with ages, only 46% of adults older than 65 had been vaccinated by 2020, probably because of the cost. Also free is hepatitis A and hepatitis B vaccinations and Tdap, which protects against tetanus, diphtheria, and whooping cough. A third major change, when prices for drugs covered under Part D and some under Part B increases faster than inflation rate, the law now requires drug manufacturers to pay rebates or face stiff penalties. Although those rebates will go to Medicare, not to individuals, if you're responsible for a portion of a drug cost, there are limits on how much that can increase. In theory, your costs should decrease. In 2025, which is 2 years away, Medicare will set a $2,000 annual limit on out-of-pocket costs, which is, I think, about $166 per month for Part D beneficiaries. Nowadays, a lot of drugs can cost $500 or $1,000 a month. So having $166 per month cost, which is about $2,000 a year, will be a significant reduction. So if you take 10 medication, that adds up to a high out-of-pocket cost. A kind of cap will take even effect sooner in 2024. That's when Medicare will eliminate the 5% copay that beneficiaries are responsible for once they pass the catastrophic expenditure threshold, effectively limiting out-of-pocket costs to $3,250 as well. So I'll keep you up to date on this and everything else going on here in our country on a daily basis. If you haven't yet, make sure to subscribe down below. Click the subscribe button and the bell icon so you don't miss out on new videos. There's a lot going on here in Congress. They're going to be trying to pass a lot of things here on a daily basis. So click the subscribe button. Remember, new videos come out here every day at 10 a.m., 3 p.m., and 8 p.m. Eastern Standard Time. And thanks so much for liking and sharing these videos. Here's some videos you can watch next. Here's a video about Social Security and 2 important letters that are going out right now. And here's another video about $1,200 checks going out from the IRS to millions of people. So click on one of those videos next. Thanks for watching, guys, and I'll see you in the next video.